I'm really happy to be here this evening. Hello to everyone. I recognize some names there on the list, and hello to everybody in the future who will be tuning into the recorded session. So yes, I have been quite an advocate for Medicaid expansion during the whole duration. I would like to cover first a little historically what's behind that. And so without further ado, let me dive into the history a bit. As you all will recall, approximately 12 years ago, President Obama put forth the Affordable Care Act, and it was passed, thankfully, and it brought lower cost insurance to many folks who otherwise could not access medical insurance. It was certainly a huge benefit to those who qualified. Unfortunately, due to the wording of the original piece, there was, or the original legislative piece, there was controversy that, as you know, went to the courts. And in the end, the courts decided, unfortunately, in my view, that each state could make their own decision as to whether to participate in Medicaid expansion or not. And our state, at its first opportunity 9 years ago, and multiple times since then, I think sadly and mistakenly chose the path of not expanding Medicaid access to those within the gap. And you can get online and study more about this. And in fact, the numbers are not burned into my brain, but there is a portion of folks who are making too much money to obtain Medicaid that is provided to the most impoverished, but not enough money to receive supported insurance as provided through the Affordable Care Act. And those are folks who are left in the gap. And different experts weigh in, but it's somewhere between probably 500,000 and 600,000 residents in North Carolina, and specifically in our county, well over 4,000 residents who fall in this gap. Many of these folks in our county were the patients of our practice. My brother and I probably had hundreds of them, and I will be speaking to some of their experiences a bit later in my talk, but the human cost is profound. I mean, hundreds of thousands of folks in just our state alone who, if they were living in Virginia, would suddenly qualify for insurance because Virginia has had the good sense to go ahead and expand Medicaid. I'd like to talk a bit about hospitals for a moment, and health of hospitals, and specifically rural hospitals. Our county, as you know, has 2 hospitals, and both the one in Eden and the one in Reidsville have been solid members of the community for decades and have provided tremendous care. Eden's was Moorhead. It's now UNC Rockingham, supported by the UNC hospitals. Danny Penn joined in with Cone Health, I guess 12 or 14 years ago. Both the hospitals provide tremendous amount of care for our residents. They're really foundational to the community, to the economic health of the community. They are 2 of the largest employers in the community. With the existence of our community hospitals in rural areas, we have a much higher likelihood to be able to recruit specialists to the community, to be able to retain physicians, to be able to retain physical therapists, occupational therapists, all the other supportive health industries that can help folks sustain a healthy lifestyle, and they're really crucial to the community. And one of the very, very sad things that has come about from the lack of Medicaid expansion in the dozen remaining states, including North Carolina, which has not expanded Medicaid, is rural hospitals, which provide a higher level of uncompensated care and also tend to provide more primary-based care, which unfortunately our medical system pays huge dollars for fancy procedures, but when it comes to just good, meat and potatoes medicine, caring for someone with pneumonia or heart failure or dementia or standard emergency room care or hospital, just standard hospital care, the economic margins are a lot tighter. And when you have a community such as ours where Medicaid has not been expanded, the hospitals in our county and in all the counties across the state are providing a higher percentage of uncompensated care. And we're dealing with the challenges that in the last decade, the states that have not expanded Medicaid are seeing their rural hospitals falter at a much higher rate than those that have expanded Medicaid. In fact, it's on the order of 400% higher rural community hospital failure is 400% higher in states that have not expanded Medicaid. We saw Eden's Hospital go through a bankruptcy proceeding approximately 4 years ago. UNC Rockingham stepped in, has supported, but even that, they only made a commitment to 5 years of maintaining the hospital exactly like it has been. Also, we saw in the last 2 years, Ashborough's Hospital, Randolph Hospital declare bankruptcy. They too have been buttressed up, but with no guarantees for the long term. So it's really an unfortunate thing that our hospitals in the rural areas of North Carolina are facing much more pressure because of the fact that we've not expanded Medicaid. And I think it's a crime personally, and because they do so much for the community. And I think our rural legislators in turn should be doing everything they can to build up our community hospitals, and refusing to expand Medicaid has been painful and is harming the sustenance of rural hospitals in our state, and it's a shame. I'd like to also speak a bit about women's health, because that's an issue that's important to me. It's not just OBGYNs that do women's health. Primary care physicians, of course, take care of women, and it has really bothered me. And this is kind of stuck in my craw, so bear with me. So often I have heard legislators on the other side of the fence who have said, no, we must not expand Medicaid. That one of their big pushes has been to go on and on about how expanding Medicaid would somehow provide unnecessary help to able-bodied folks. And so that phrase has always concerned me. And when you get right down into the details, most of the folks who in North Carolina would benefit from Medicaid expansion are women, and most of these women work. They just work in jobs where they are not provided insurance. They also work in jobs where they do not earn enough to qualify for support through the Affordable Care Act. So this idea that there's this whole able-bodied contingent just sitting around, just waiting for handouts is a bunch of baloney, in my view. Most who would benefit are working, most are women. And what really aggravates me and disturbs me about all this, these women who are uninsured pay a severe price. The American College of Obstetricians and Gynecologists did a study that showed 30 to 50% higher risk of dying from cervical cancer and breast cancer for women who are uninsured. And recently I wrote a piece for the Greensboro newspaper, and I spoke about a sad patient early on in my career who was uninsured. And this young lady skipped her physical. She was in her early 30s. She would only see me episodically because she could not afford regular care. And she came in one day with back pain. And the back pain turned out to be cervical cancer, metastatic cervical cancer. And she had 2 kids that I also took care of. and she died from her cervical cancer. And those two kids ended up, they did all right, but they came up underneath their grandmother, and their grandma did her best. But it was sad to think that if we had lived in another society where preventive care was available to all, which to me should be our ultimate goal, for sure. Like every other industrialized country in the entire world, she would have survived with the timely pap smear, and these kind of things are painful to see. So I do believe that there are something like nearly 300,000 women who would gain insurance in our state. And even though there may be initiatives in some counties to provide physicals, like through the health departments, et cetera, the fact is if you have insurance, you're much more likely to take advantage of access to standard preventive care. And standard preventive care can save your life. And the fact that our legislators who, deem themselves as caring about families, et cetera, decide to reject Medicaid expansion and literally put hundreds of thousands of women in North Carolina at risk and thousands in our county, it's shameful and it's wrong. So sliding over to COVID, I was still working actively when COVID hit. In fact, I gave an 18-month notice in order to try to recruit a partner. COVID did not run me out of practice. I gave the notice before COVID came along. But COVID was a stark reminder, and still is, of how lack of insurance increases harm to the individual and to the community at large. I saw numerous folks sick with COVID who delayed their care, who delayed coming in, or who declined my recommendation to go on to the emergency room or to have further testing just to see how sick they were. And that recurred numerous times and was once again very painful to experience. Yes, there were federal initiatives to pay for your care if you were hospitalized with COVID or if you went to the nursery room with COVID specifically. But if you're coughing and you have fever and you're short of breath and I don't know what you have and you might have COVID, I can't say, just forget about it. I got to send folks to the emergency room. And some of these folks end up not having COVID. They may have something else, but they don't have thousands of dollars in their bank account to pay for the cost of that evaluation. So many folks decided to skip that evaluation. And some got in real trouble with it. I had several hospitalized too late, in my view, because they waited because they had no health insurance. So COVID once again laid bare the fact that the lack of insurance has repercussions in so many ways. We will be hearing from a patient shortly, Virginia, regarding her experiences. I did want to share with you a couple of my patients that come to mind of the hundreds who weren't insured but who could qualify for Medicaid. And one lady, I have used her as an example since I've started pleading in so many ways, both written and verbalizing and press conferences, et cetera. And this is a lady who's cared for a child that she delivered 20 some years ago, and this child had severe birth defects. I was there at the delivery. We resuscitated him. He faced all kinds of challenges, a shunt to his brain, and ended up getting a tracheostomy and recurrent admissions to the hospital for pneumonia and infections and kidney failure and the like. And he was so fragile with his condition that she, the mother, stayed in a cot in the hallway for the first decade of this child's life. And when I would go out to do house calls on the child, her bed was literally a cot in the hallway. And yet she was caring for a child day and night, keeping him out of the nursing centers, basically saving the state probably $70,000-$80,000 per year, maybe even more in nursing home costs for this child. And yet she couldn't qualify for Medicaid. Her husband worked as a farmhand. They didn't make enough money. They were in the gap. And for years, she and her husband skipped some really important, crucial healthcare steps that could have made all kinds of difference in their quality of life, because she had to stay home with her ailing child. And she is still home with that child, and she is still uninsured, or at least was when I retired from my practice. And for our state not to provide insurance for folks like her, that's beyond the pale. And then to, point a finger and say, well, she's able-bodied. Well, this lady is sleeping in the hallway caring for a child day and night, and somehow the state deems her not worthy of insurance support. I think that's an amoral position, and also economically just not a smart position, to say the least. I have all of these patients rolling through my brain, and I recall just another one this past spring. I had not seen her for over a year. She's diabetic. Her blood pressure is not in great control. She came in, her numbers stunk as she had lost her insurance when her husband lost his job when COVID blew in. She was a cancer survivor. She had skipped her oncology visits because she couldn't afford that. And so once again, just painful to watch her go through that. I could go on. Of course, you all know the pain that so many are suffering, but I would like to speak to a few specifics about how our county could benefit from Medicaid expansion, and then I will close my presentation, and then I'll be happy to open up to questions before or after Virginia presents her side. So the Kate B. Reynolds Charitable Trust, that's sponsored by Cone Health, studied the economics in each county in the state and how they would benefit. And what they found is if we expanded to Medicaid within our county alone, something on the order of 4,500 souls would qualify for insurance immediately. And I've already told you, this would save lives right away. In fact, the experts think it's something on the order of 1,000 to 2,000 lives per year in our state. Most of these jobs would be in healthcare, but there'd be other jobs that would be supported. There is something that economists call let me get this right, it's the gross county product in millions. Instantly $20 million more of federal insurance or federal tax funds would flow into our county, and think of the multiplier effect that would have. And ironically, these are taxes we're already paying, but just are going to other states who've been smart enough to expand the Medicaid. Tax revenue in our county, which is something that, of course, Jay Donecker was very concerned about in his prior important positions. $700,000 extra tax revenue per year immediately would start flowing. Imagine the benefits to that. The state itself would receive some $3 to $4 billion per year, and there is a current offer on the table from the feds, if we join in soon, to get an additional $1.5 billion over a couple years, which would be awesome. There were two things that I just wanted to mention that I didn't mention in my piece for the newspaper. I understand there's going to be an entire session on this soon, but the opioid crisis is tremendous. I've had a couple young patients pass away in recent years, very sadly and tragically. And the studies have shown in states that expand Medicaid, there's immediately more access to more counseling, more medical assisted treatment that has been shown scientifically to reduce overdoses and reduce deaths. So this would be a real palpable benefit to our county and across the state. And another thing I often don't see mentioned, the Rockingham County Jail, when it admits patients who have no insurance, and those patients get sick and they have to be hospitalized while they're in the jail, the county immediately pays all the money for their hospitalization. And I'm telling you, this is a lot of dollars. I've watched some of these sessions where the commissioners were approving $40,000 for the health care of a inmate who had no insurance, who was residing in the jail at the time that they became sick and required a hospitalization. If they were on Medicaid, then that cost would be assumed by the Medicaid system. So I've read articles on this. I haven't seen it spoke too much, certainly not locally, where unfortunately a lot of our elected officials curiously are against Medicaid expansion, although I'm very happy to see that Phil Berger has pretty much changed his position and come around to what I think is a very helpful and healthy thing for our county. But the county jails would see their health expenditures, I think, do so much better if we could get folks more qualified on Medicaid. But at any rate, I've covered a lot of things. I'll probably bring it to a close, but there are certainly many aspects that would benefit tremendously if we just did the right thing and expanded Medicaid.
Thanks, Dr. Luking. That's very compelling. It is true that the state Senate has now passed in a very overwhelming vote to consider Medicaid expansion. The key will be to work in concert with the governor and with our House of Representatives. Our House of Representatives seem to be dragging their feet. What really is very telling for all of us to realize is that this is a problem in which there are myths in the background of people's minds. And the only way we're going to change them is literally one at a time. And one of the call to actions from this program will be that I will request that please start a conversation with people. And if you can see that they push back and they don't say, oh, no, Medicaid expansion, I don't understand. Please, I would love to be able to sit down and speak with these individuals, because it really will have a huge impact on our county. But rather than have me go on any further, I would like to now turn it over to Virginia, who can just speak about her experiences in being injured, working. I mean, listen to the profile that Dr. Luking already said. It's a woman who is working. So this right to work clause to make everybody have to work is a myth. And we just have to start poking holes in this, but we're not going to do it in a broad base. We're going to do it just like my campaign. It's going to be in onesies and twosies, but it's the right thing to do. So with that said, Virginia, could you please introduce yourself and just take it away?
Absolutely. Can you hear me all right?
Mm-hmm.
Okay.
Yes.
Hi, I'm Virginia. A graduated student from RCC with a wrist injury that has completely devastated my life, pretty much. So, back in August, I worked on a horse farm, and we had an accident, and I was like the second one on the scene, and I had to grab the horse, and he spooked. And when he did, he pulled back on my wrist. And we thought initially, let me say, at the time I was not insured. So that's kind of big. Initially we thought it was a bad sprain, and I went to the ER. Okay, let me take a couple steps back. So I work at a fast food restaurant in town, and before we went to the ER, I didn't think anything about this injury, and I went to work. I had consistently moved 25 pound T-urns. I used constant wrist motions and things of that nature, passing out money, passing out food. So as a couple weeks went by, and the injury progressively got worse. My mom made me go to the ER, and the doctor told me it was just a bad sprain, just put ice on it. And in reality, it was not a bad sprain. And that costed me about $600 out of pocket for an x-ray that showed absolutely nothing. for me sitting in the ER for 6 hours straight just to say, just put a Band-Aid on it, you know? So months went by, and it's almost been a year, and this injury is, you know, still like wrecking my life. As months went by, we realized it was more than just a sprain, and I finally got myself to get an MRI, which costed me about $510 out of pocket. Well, let me say, at the time I had insurance at this point, but this insurance is very bare minimum. It covers very, very little. And going back to what Dr. Stevens said about women's health, this insurance also does not cover my birth control. So I have to pay over $125 out of pocket for that and checkups and whatnot, which is completely aggravating and should not be a thing. But that's besides the point.
You're right.
I mean, I wanted to touch it, but I didn't want to interrupt. But yeah, that's an absolute massive point you touched on, because I struggle as a woman, you know, getting my birth control over something I don't want anything to do with, and it should not have to cost me $90 out of pocket each visit. You know?
Wow. Yeah.
But as time went on, my insurance did not cover this MRI, which was obnoxious, but we finally got the results I needed. And I had to jump to different physical therapists in order to find a place that actually took my insurance. But before that, I had to pay $125 for even my first physical therapy. And even then, it was just kind of like a checkup telling me, oh, this is what's going on, this is what you have to do. And again, that was $125, and it'd be $125 continually had, you know, my insurance had not covered it. So I had to stop my physical therapy from that place, which was not good, and my injury has now progressively got worse because of that. Almost a year later, I finally found a place that takes my insurance, and you know, it's just been a real struggle paying very little money for insurance, and you know, still working at that fast food place, doing what I usually do, and it's a hassle. It's really put a dent in my life. You know, I can't ride my horse. I can't draw any, because you know, I said I was graduated from RCC with an art degree. I can't do anything with that right now. I can barely drive. I mean, it's awful. It's not something I would wish upon anybody at this point, especially those who don't have insurance. I got lucky to find a place who took my insurance, which is kind of a foot in the door, but yeah. Kind of a briefer.
No, thank you, Virginia, for sharing that, because basically one of the things that jumped out at me is the timeline from when you were injured to when you were finally being able to access care. And the first step before care is diagnosis. And this is happening hundreds of times in our county. Listening to Dr. Lukens, probably thousands of times. And just because somebody's healthy at this moment, they're not bulletproof if they don't have insurance. Something is going to happen to them. And this is where we just need to get enough people to recognize the magnitude of this issue, and to basically hold our legislators' feet to the fire, our legislators' feet to the fire, so that we do have Medicaid expansion. I know the John Locke Foundation, very conservative, has been against it first. They said, oh, North Carolina can't accept it. Well, now that the Senate says, oh, yeah, we can, now they say, oh, but we don't think it's sustainable for the federal government. And what we should do something if it benefits us, and get into a negotiation with the federal government, that if we're afraid the federal government can't uphold the end of their bargain, you don't bargain. You don't not bargain with them. What you do is you put a clawback provision in there, which other states have done. So if they don't hold up their end, fine. Meanwhile, personally, I think people are just stuck that a certain party, the Republicans, staked out 12 years ago that this was bad for the country and bad for its citizens, And by goodness, it's not going to happen. And now we're going to witness going forward a party that's going to try to thread the needle to make it look like, oh, they've always been for affordable health care. In fact, we see advertisements right now for that. They say they're for affordable health care. It's not true. And we're only going to change it at the ballot box. But I'll get off my soapbox. Dr. Lukin, do you have?
Yeah, well, I would like to say a couple of things. So, Virginia, you describe having not very good insurance that requires you to pay substantial money for your preventive checkup. And I would reply you have horrible insurance. And all the supported insurances through the Affordable Care Act would provide preventive care for free or covered 100% without any payment from you at the time, if you had qualified for that. So obviously you didn't. And secondly, if you had received Medicaid coverage from the get-go, your preventive would be covered 100%. So you do have horrible insurance, and I guarantee you that you would do better being covered by Medicaid in terms of covering necessary care and preventive care. The other thing I'd like to say is the very same kind of sorry excuses that we've been hearing so often from the folks who are against Medicaid, we heard from the very same group of folks a half a century ago when they were rejecting the development of Medicare. It was all the same canards, this is socialism, or, this is somehow un-American. And at the time, they bamboozled quite a few folks into saying, oh, we don't want Medicare. But in the end, of course, it came through. And I would ask you to ask any Medicare recipient these days, what's their thoughts about having Medicare versus not. And I think you would find that Medicare is incredibly popular amongst its recipients now, as it should be. And similarly, when Medicaid is expanded, that becomes very popular too. And so the old arguments that were used a half century ago against Medicare, against Social Security, now are being used against Medicaid to those folks who are in need of care, and it's a bunch of baloney, and we just need to get beyond it somehow.
Steve, how much has Rockingham County hospitals, how much have they lost due to non-payment that would have been covered by the expanded Medicaid? And let's just either annually or over 10 years or whatever number you're comfortable for sharing.
Well, so sure. I know the Annie Penn side of things. My understanding is on the order of $9 million, and this is, and of course that it's beyond just Annie Penn. We have UNC Rockingham. We also have all the offices out there, like our office. We would care for uninsured folks, and I would commonly write off their care or charge them under code, so to speak. And you can only do that so much. And so it's the hospitals, but it's also the pharmacies, it's the physical therapists and speech therapists, and on and on and on. There's a lot of money that would flow. And this isn't about people making money. This is about people getting care. And this is about systems sustaining themselves. Let's be real here. Half of the hospitals in our county have declared bankruptcy in the last 4 years. I mean, that's the reality. And if we had expanded the Medicaid back when we first had the opportunity, and our county and state legislators and had the good sense to dive in, the studies are showing we would have had a much lower risk of facing that bankruptcy. I do want to take just 20 seconds and also talk about the clinical studies. They are exploding in the medical journals now. We're finally, after a decade of states who've expanded Medicaid and states who've not. They're showing that in states who have not expanded Medicaid, higher amount of folks progressing to dialysis and kidney failure, higher number of folks dying from ICU conditions, higher amount of death rates in general. Those that have expanded Medicaid, tens of thousands of lives saved, higher quality of life, less blindness, less amputations, less dialysis, less disability. So all these studies are now flowing in, showing hands down the choice of going for the Medicaid expansion has elevated the health of the communities.
That's an excellent point. We also, Dr. Luking is part of a group that were recruited by people like Laura Phelps 20 plus years ago, and Sylvia Grogan did the same up at Eden Moorhead. That group of physicians are now retiring. And what we're witnessing is it's being very difficult to refill those positions. And when you have two operations that are losing between $8 to $10 million annually, it is hard for that operation to secure enough dollars to be able to pay adequately to be competitive with physicians that are also being recruited competitively into other systems or other locations within the system that can pay more. That's the reality. So when somebody complains to you in Rockingham County about having to run to Guilford County to see a specialist, or having to wait a long time in the ER, or complain that they just can't get the level of care that they think they deserve, feel free to say, you need to talk to Jay Donecker.
Yep.
Because if they want somebody who's going to advocate for what needs to happen here in Rockingham County, it's going to be me and the Democratic Party. But most importantly, I will be able to put a face to the issue in the legislature. And you're not going to see me kind of go with the flow just to kind of keep things going along. There is a real need for Medicaid expansion in Rockingham County, and we're the poster child for it. And by goodness, we need to make that people aware of that. And somehow we're going to have to lead the horses not only to the water, but get them to drink, and then get into the voting booth and vote.
Yep.
So I want to thank both Dr. Luking and Virginia for presenting this very compelling subject. I'm just checking right now. No more questions. I'll call one more time for any more questions, and then we'll wrap up the session. I also want to thank Dylan Moore, my campaign manager, for managing this inaugural Zoom presentation with no glitches, which is, it just blows my mind. I just figure the first one we would have had some glitches here or there, and it has not occurred. And this will be recorded and put on our website with a link in the coming days. Are there any other questions that somebody wants to send to the chat? Otherwise, I'd like to wish everybody a very good evening. And thank you for attending and taking this time.
Thank you.
Your support in the future, and hopefully your vote. Good night.
Thank you.